Choosing the type of breast implants you want is an important decision. They actually have unique advantages and disadvantages, and it's important to have an in-person consultation with a plastic surgeon to determine which of these is right for you. But just to give you a brief overview of the different types of implants in Canada, you can have a saline-filled implant, an implant that's actually filled with saline but actually has multiple layers on the inside, almost like layers of an onion that help the water not sort of slosh around as much as they would in a regular saline implant, or an implant that has silicone on the inside. It's really important to realize that every implant in Canada has a silicone shell on the outside, so that's what's in contact with your body no matter which of these you choose. There are some unique advantages and disadvantages. Again, this should be discussed in person with your plastic surgeon, but I think a saline implant can potentially be inserted through a slightly smaller incision because you can obviously roll it up and insert it and then inflate it, so that's an advantage. And you can adjust it so you can make one side bigger than the other. That's another major advantage. They're a little less expensive. Some papers have suggested that they are less likely to cause scar tissue around them called capsular contractures, so that's important. They do have a higher breakage rate than silicone implants, though. Again, this is not an exhaustive list of the pros and cons, but moving on to these implants made by the Ideal Company, the idea of putting a whole bunch of layers on the inside, sort of like layers of an onion, which is hard to sort of see when you're looking at the implant on the outside, but there are multiple layers with water in between them on the inside. The idea is that it will hold its shape better than a regular saline implant, and they definitely have a lower breakage rate. One possible concern with these implants is there are two valves, one on the front and one on the back. Regular saline implants only have one valve, so you might have a higher deflation rate with this type of an implant, although long-term numbers would give us that information. And then on to a silicone implant. Silicone implants have some unique advantages and disadvantages. I think one of the advantages is they tend to hold their shape a little bit better, so that might give you more upper breast fullness. If the implant is sitting in your body, it might help retain the fullness up top that people are wanting in the cleavage. They are very durable. They have about a 1% risk of breaking every year. It is important to realize that's a cumulative risk, though. So over many years, that risk slowly goes up. So advantages are holding their shape better and possibly giving you more upper fullness. I think possible disadvantages are that potential for rupture and what's inside getting out. They are full of a very thick gel that's supposed to stay put, but if they are broken long enough, there is a possibility of those fragments getting away. Some people are concerned about breast implants leading to rare type of disorders called collagen vascular diseases like arthritis and skin disorders. Those studies are ongoing and certainly not conclusive. And I think one of the other possible disadvantages of silicone implants is a slightly higher risk of capsular contracture, which is the body walling them off and getting too firm. Although some studies have suggested that if you put the implants above or below the pec muscle rather than above it, that risk is minimized. It's important to realize that you can't fit in all the advantages and disadvantages in the course of a few-minute talk, but we have a long consultation together and I go over all of the pros and cons of the implants together.